you guys are all BComs, I guess? Or, okay. So, I guess this is a health career symposium, so I'll try to make it more related to health. But I was just wondering, I also like to think that they're more interactive as opposed to just talking in front of you. But do you guys have any idea of why anyone would actually want to have a financial advisor? Sorry?
You want to manage your assets efficiently.
That's one part, absolutely, yes.
Keep track of them.
Keeping track is absolutely something else, yeah.
I'm the only one who has an answer yet?
Yes.
To make
when there are 3 people in a room, it's hard to
well,
it's a small group, so at least this way I get to pick on everyone.
Just the biggest bang for your buck.
That's actually the best answer.
Yeah.
how to learn to make your money work for you.
That's
so you can
exactly
make
it.
more money.
People work really hard for their money. And especially in this province where half of the last dollars that we make are not going to us but going to the government in taxes, what we really do is try to get the money to work hard for them. And I guess that kind of goes into the whole health and wealth, right? Because if people have issues with their, money problems, it will also lead into the health problems later on with stress and stuff like that. So what we do is basically deal with the whole financial situation of people. And so what I'll try to do is talk about how it might be useful in your situation. So I actually started in this career straight out of university. I did a BCom actually, but at McGill, not at Concordia. Not that there's anything wrong with Concordia. And so when I graduated, it was the only job I ever did, and I started straight out of school. And I didn't have a lot of connections, but I had good relationships with my professors actually, so I got compliance through that route, and then I grew through referrals over time. It's been 13 years, and things evolve over time, but what's interesting is this is the only thing I've ever done, so it's all I really know. So the question is, why does it actually matter? Because there are many different areas in people's finances that will affect them, and so what we actually do is we focus on many different areas. It's not just one area. And what happens is they're all linked to a certain extent. So what happens is when people start off, you guys are still in school, so you're not in the situation where your biggest issue is paying taxes, right? But that's kind of the goal, is to get to some point where you're making a lot of money and paying taxes, as unpleasant as that is better than the alternative of not making money. So a lot of people will say, Nick, what do you do? In terms of financial planning, and how would that be helpful for me? And so the way that we explain it is basically, there's a small part of what we do that's called investment planning, and that's what you were mentioning earlier, right? That is pretty straightforward, where we'll sit down with clients, and given their age, their goals, their tolerance for risk and volatility, we can determine what's appropriate, whether that be stocks, bonds, mutual funds, mortgages, whatever out there we have access to. And in this sense, it's not much different than any other financial institution. There's really no shortage of companies in Canada that are very happy to take over people's finances and assets, right? But the key thing that I differentiate myself with when I'm talking to my potential clients is that we don't proceed on that part until they incorporate into a much larger part of the picture with what's called financial planning. And so I'll just explain to you what that actually means. So financial planning is actually made up of many different areas of expertise. There's tax planning, there's retirement planning, there's estate planning, business planning, which might be very useful for you guys down the road, mortgage planning, and insurance planning, right? And all of these things have different impacts on different people. And so what we want to do is find out how it impacts their individual lives, because everyone has a unique situation. So the first thing when it comes down to tax that we'll ask is, who do they work with? Is it a software program that they're using, or is it an accountant? And if they're using an accountant, is that accountant communicating with the financial professionals that they're already working with? And most of the times it comes out that there actually is no communication going on, so a lot of ideas are falling through the cracks. And so most people do not actually get tax planning strategies. Then the next thing is retirement planning. And as you guys are probably aware of just listening to the radio, this is becoming more and more of an issue with our society as people are living longer and longer with longevity. Because why? All the pensions that were promised have to be funded, right? And where's the money to fund all of these things when the actuarial assumptions assume that people are going to pass away at 85 and they're living to 95, right? And so our generation is this unfortunate situation where we have to take more of that responsibility, as opposed to the baby boomers where they could just rely on the system to take care of us. Now a lot of what I've seen with all my clients that are below that age, it's the pensions that they're going into are altered from what's called a defined benefit formula to a defined contribution. Do any of you guys know what those terms mean?
Financial contribution?
Yeah, no, defined benefit versus defined contribution. So it's a pension. What happens is a defined benefit is you just work a certain amount of years, you know, whatever, 35 years, and then at your last 5 years, they'll take your earnings and then pay you a percentage out for the rest of your life, and so you don't have to worry about anything after that. That's rare and more rare, you know, unless you work for the government, and even they're starting to phase it out. So what we see more is what's called the defined contribution plan. And does anyone know what that is? Well, that just means that you're going to get some matching and that all the risk is borne by you, the employee, as opposed to the defined benefit, which is all the employer. So what's happening on the retirement front is more and more people are becoming more and more worried as they get closer because they realize that they cannot rely on outside sources to take care of it, so they have to take the initiative to plan for themselves. And then the issue becomes that everyone's different because, you know, I'll have lawyers that want to retire at 55, you know, I have medical doctors that are doing research and working in their 70s, and so it's not right or wrong, it's just getting numbers, but the key is we find it's better to have people work because they like it and not because they have to, rather than being forced to work because they failed to plan, right? There's a good expression saying, people don't plan to fail, they fail to plan. And that's the truth when it comes to retirement. And so we can see that. And at the end of the day, if retirement's okay, well then we go to what's called estate planning. Does anyone have an idea of how estate planning works?
Well, your parents and all that stuff.
Exactly, yeah, exactly. So you guys might be more worried about your parents' estate planning for you at the end of the day, right? But basically there are two different types of estate planning. There's legal sides and tax sides. And the legal side's pretty straightforward, which just means having the will and the documents in order, which most people don't even have. But then it's the tax side where we really focus a lot of our attention. Because I don't know if you're aware of what happens in Canada, but if one spouse passes away, although they can give everything tax-free to their spouse, when the second spouse passes away and goes to kids, then there's what's called a deemed disposition. Exactly. So what does that mean is people think they have all this money in their RSPs, you know? It's $1 million. Well, actually, it's all subject to tax at that point, and half of it's not going to the family, it's going to the government, right? Things like houses are okay because you get what's called the principal residence rule, but something in Canada that's very popular are cottages, right? And there's what's called a secondary residence where there's a capital gains exemption. So all sorts of people, although they don't even plan for their retirement, don't plan for what's going to happen after to make sure their family gets more. And so we will do that, but only if it's important to the client. And that's where we want to find out. And this is where he was mentioning before, that's the key is, yeah?
So my mom passed away recently, so
yeah.
Her estate got transferred to my dad.
Tax-free, it rolls over. Yeah,
to my dad.
Yeah.
Now I'm an only child, so after my dad passes away, I'm going to be paying taxes.
You won't, the estate will. So what happens, there'll have to be a terminal tax return that's filed, right? Okay. And then your father's assets will be deemed disposed, right? So it depends on the type of assets they are.
It's a house and the insurance policy.
House is tax-free.
And stuff with investors group, to be
honest. Okay, is it with an RSP or a RIF, do you know?
No, it's Dan Hubert that's taking care of it.
Okay, Dan's a good guy, yeah, no, the office, yeah.
Is that all what I get?
It depends on the type of assets that they are. If they're a pension type, like a RIF, like if that's where your dad's getting the income, that's subject to tax. If it's a non-registered, it's just a capital gains that's triggered. Okay. If it's tax-free savings, it's tax-free, right? But Dan should be going through this with your dad, and I'm sure he has. And the fact that he has insurance is the key, because insurance pays out tax-free. Okay. Right? So that'll be there to deal with. So the bigger thing is cottages and big registered plans, or stocks that have been held a long time where they're capital. Yeah, so it won't be a huge thing, right? But because you're an only child, it's relatively simple. But when you have 3 kids, it gets complicated because it's like, well, who gets the house? You know, if you get the house, how do you make it fair for the other kids, right? And so that's where it's not just about money, it's also about fairness, right? And so I'm assuming, I know Dan very well, that he's probably reviewed it with your father and they've got a plan in place, you know?
I don't know yet.
Yeah, so, but you're lucky that Dan's in the situation because, but that's a good example, right? And so we have these conversations with our clients because of the fact that not just themselves that they care about, but it's their family as well, right? So I'm sure your dad's, if he has life insurance, is probably, at the end of the day, going to go to you as the beneficiary, and because his life insurance goes tax-free. And it also bypasses the estate. So you can go, it goes directly to you, right? Whereas the house, the assets have to go to the estate, life insurance bypasses the estate. So that's the kind of stuff we do. Which life insurance, all this doesn't sound super sexy, right? That's a good way to put a room to sleep. These are key tools for the planning process. That if people want to see more go to their family and less the government, there are many things that we could do. And then other things that we can do are business plans. And that might be something for you guys if you're ever thinking about it. Something for a lot of the doctors that we work with, because actually, I don't know if you're aware of this, but medical doctors in Quebec are actually allowed to incorporate for their clinical income. So that's become something very big for us, where the personal tax rates in Quebec are the highest in North America. So for the last dollar at a certain income threshold, what that means is half of it is not going to you, it's going to the governments, right?
That I know.
If you set up a company, then the taxes are taxed at 19% and not 49%. So that's a big difference,
I was
right?
told it was 30%.
That's not, with the small business deduction, you get that at 19%.
Oh, okay.
So a small business deduction is for a CCPC, a Canadian Controlled Private Company. So if you have your own company, it's pretty easy to make it a CCPC, right? But with the small business deduction, 19%. But then the question becomes, people need money to live, so how do they get the money out of the company? Because then you got to do it through dividends, but you can use family members to income split, and the strategies become more complex. That's what we do in a nutshell. We do it with a lot of doctors, so that's where I guess it falls into the healthcare symposium, right?
Yeah.
But it's interesting, and then again, you get to another complex layer where companies can actually own insurance policies and pay for it with after-tax corporate dollars. Yeah, exactly. So that's what we do, and the key thing is all about that is that none of them can be looked at in isolation, because you can't look at the investments and say, are they good, are they bad, without saying, how does that impact the taxes? How does that impact my retirement? How does that impact my estate? You know, and so what we have to do is take a holistic approach. Kind of like the same way as if you look at osteopaths, you know, they're looking at the whole body as opposed to, like, my dad's actually a doctor and he's a psychiatrist and he'll look just at the brain and, you know, they'll look at the whole package more from a holistic perspective. It's the same way with financial planning. So it's all about that, staying on top of it. And then the key thing is with everything is if you think that you know it all, that's when you're in trouble, because the only thing that we know for sure is that things are going to change. You know, so much has changed in my own career where just new legislation has come in with new programs like tax-free savings accounts, you know, things that didn't exist when I started, and other things got phased out, and so the key is staying on top of it. So what we're seeing is in more and more student situation is that, you know, tuitions are going up, life expenses are going up, you know, it's getting harder to take care of the finances, so people are going into debt. And so that's something that we talk a lot about. And then so what we need to do is, someone mentioned before, it's the budget, right? And so that's key to everything is the cash flow, you know, coming in versus going out, and drawing up a spending plan. Because without saving at the end of the day, you have no investments, right? So that's really what it comes down to, is analyzing the cash flow and how it fits into these things. And then the key thing is when it comes to students and their different types of debt, so I don't even know your situation, what we see is it's incredibly easy to get access to debt these days. You know, companies will bend over backwards to give you credit cards, you know, whatever it is, and that's not necessarily in the student's best interest, right? And so we will encourage a lot of students to avoid that type of thing. And even if it involves taking a personal loan or something like that at a lower rate, where there's built-in payment options that people automatically do. So as a simple principle for a lot of the students that we work with, we can do a lot of these types of things, but we want to keep it simple so it doesn't make the situation overly complicated and they don't build up balances where there's a lot of interest cost. And so that's another thing along with taxes that you don't want to pay. So then after people pay off their debts and taxes, they'll save. And questions come up such as, where should I save? In an RRSP, or should I save it in a TFSA? Do any of you guys know what these terms mean? Right?
Tax-free savings.
Exactly. So the difference is that one is a pre-tax dollar and one is a post-tax dollar. So the answer, like everything else in medical science, is always it depends on the scenario, right? So RRSPs are always sold to us as the best thing since sliced bread, right? As a retirement plan. Well, they're not a plan, they're a tool that's part of a plan. The key thing with RRSPs is they're very important if someone's in a high tax bracket, because they get to deduct that contribution from their income at a high rate. But the aspect that is not always mentioned is not a deduction, it's a deferral, because the RRSPs have to be taken out later, and when they're taken out and they're taxable income. And that's why we're talking about the estate issue when it's all subject to tax. So it's as if you sold all your RRSPs at once. So RRSPs are a tool that is useful when people are in a high tax bracket and they can defer taxes. What's great that I see these days is for younger people, you have to be over 18, I assume you all are, right, are TFSAs. Because you don't get a deduction, but if you're not in a high tax bracket as a student, you might not need a deduction. But at least the money that you can grow in this account can grow tax-free. And it can also pay out tax-free. And what's also fantastic about this plan is you can actually put it back in. So for example, you're allowed 5,500 per year, and it carries forward, so about 30,000. So if clients have put in 30,000, it's worth about 40,000, and then they use that for like a down payment or a car. Well, it's not like it's all lost. What that means is the next year, it's not just the 5,000 that they can put in. They can put in 45,000 because they can put in everything that they took out as well. So that's something you can do with the RSPs as well. That's very interesting. Yeah.
Small question. If you don't put anything this year, is it
Carries forward indefinitely. Yeah.
Okay.
Yeah. And so that's
Just
what.
like ours.
Yeah, exactly. Just like, well, RRSP is based on income, right? But yeah, it carries forward. This is just an absolute number that everyone's entitled to the same amount. And so it's absolutely, you carry it forward. And so that's why it's not urgent to do it. But the earlier one does it, the better, because it's not just a tax-free growth, it's also the room that they're building up. If ever they use it, they can put it back. So the answer is always those two factors, and this is where, with younger people, we have a much different kind of plan than with older people. And then the other thing is there are different goals as well, right? But it's very important to realize if you haven't done it, don't freak out, because you'll be able to do it later on. Maybe if the money's not there at some point down the road. So, but the key is just prescribing what's appropriate in the situation, because people are in different situations based on different income tax brackets, right? So that's something. Then what happens is, we were talking about this before, a lot of people that go into business, there are different types of businesses that you can do. So there's a straightforward thing, which is you just start your own practice, and you can deduct expenses against that, and it's great. But once again, at the end of the day, you're just paying taxes at a high rate. So what happens is a lot of people will set up their companies, and that's what we focus on a lot with the doctors and things like that, because the corporate rates are so much lower. It involves complexity because you have to file separate corporate tax returns, and actually this is a service that we provide for our clients as well, because what people want to do is simplify their lives, so we make sure we can do that. So that's something that's been very, very useful in the planning process. So that's basically it. Then there are other things, if you do have a successful business, that you can do, like set up your own group RRSPs and these types of things. But you've got a ways to go before you're at that point, so we won't focus too much on that. And then there's different insurance things we don't want to talk about, but like when people do start up businesses, we can get ways to attract key employees, because it's not all about just paying them the most dollars. These days, people are really concerned about the benefits that they get entitled to, so setting up these plans are important as well down the road. So that's all I wanted to cover. It's quite generic, obviously, because everyone's situation is different, but I did kind of want to give you an overview of the financial planning realm and how it might apply. And as students, it's kind of important. I never thought I was going to go into this business myself, but now there you go. That's something that you can consider as an option. So that's all I wanted to say, and if you have any questions, I'm more than happy to answer.
I have a question.
Yeah.
You're going for your corporation.
Yeah.
Is there another way that you could sync up your tax filings, provincial and federal, or they really have to be on separate dates?
Unfortunately, they can be on the same date. Yeah, but they're separate tax returns.
Yeah, but I've talked to accountants that told me that you could sync them all up at the same time, so you only have to file one tax return. Is that true?
No, you have to do a provincial tax return and a federal tax return.
Got it.
Only in Quebec, of course, right? Because we have the revenue Quebec. So
Okay.
unfortunately, it's just the way it is.
So some people tell me stuff. I got it.
Yeah, that's the other thing. People will say a lot of things.
I know, you laugh, but that's true.
If you were in Ontario, you could do that. Yeah, for sure.
Sometimes it's best to ask 2-3 opinions,
Yeah.
because if you go on the surface opinion of one person, especially
Yeah.
when it's not someone you know, even if it is someone that you know.
Yeah,
So
and now is this for a company or a personal?
non-profit.
Okay, nonprofit. That may be different, 'cause maybe that's a federal, right?
Well,
So
we're
non-profit.
provincially registered as a business. We're
Yeah,
obviously got this.
Yeah, so if you're, my guess is you'll have to file it, right?
Okay.
The Quebec government.
It is what it is.
Yeah, it is what it is.
Okay, cool.
All right, guys. Well,